Well, originally I had been working in landscaping and actually driving a bulldozer, and so I got tired of being laid off every winter time because it gets cold in Connecticut and everything shuts down. So I had started working, interestingly enough, in an adolescent drug and alcohol rehab center, and one of the women that was there was a nurse, and we got to know each other quite well. And she was at the local College of Nursing, the Ona Wilcox College of Nursing, which is now no longer in service. And she said, Ed, you'd make an excellent nurse. And originally I started nursing because I wanted a career. I mean, I was fast approaching my early 30s, and I really had no educational degree. I'd gone to college early on and it just didn't do well. And so I decided that I was going to go to nursing school, and it's actually been one of the best choices that I've ever made. It's given me so much lateral mobility. I've worked in oncology, I've worked in the operating room, I've worked in psychiatry, I've worked in post-surgical care, and for me, just having the ability to move laterally into another position. I've worked in integrative medicine. That was one of my jobs at UConn Health Center for a year. I was just to see patients at the bedside and treat them in an integrative manner. So I'm always constantly learning, and the job is constantly feeding me. Well, right now I work at Sacred Heart on the Emerald Coast in Miramar Beach, Florida, and one of my jobs is working in the operating room. But when my day is finished there, I go up on the floor and I do see patients up on the floor. So I have a dual role at the hospital where I'm working as a complementary care nurse, as that's what they call it there. And I'll go up on the floor and I'll treat patients with, if they're having issues with pain, anxiety, nausea, insomnia, constipation, or exhaustion, and using the embed movements, the yoga therapy, using the oils, using the Reiki, maybe giving some nutritional education, sitting with the dying patient in whatever arising for them. And it's great because I have really had the best of both worlds, being able to, one, work in the OR, and then two, sort of switch hats and then go treat patients from a totally different perspective. Well, it's easy, you do watch it, but let's face it, we're all impermanent. Supposedly the Dalai Lama meditates on his own death 8 times a day. That's something I read many years ago. When he was asked why, he said, well, when it happens, I just don't want there to be any surprises. So, everything is falling away. Even as we do this little shoot here, the body is falling away. It's getting older. I think one of the things in the contemplative care practice that happens is that there's such great emotional difficulty and even physical difficulty and sometimes even spiritual difficulty that you're faced with someone in a room or even in their home. And how do you sit with that? How do you bear witness, as Mary Taylor says, to what is arising, but not be sucked into it, but nor avert it, so that you're just sitting with and you're just noticing and observing whatever is coming up. And that's where the meditation practice becomes helpful, because when you sit for long periods of time, eventually there'll be physical pain, there'll be states of bliss, and how do you not get attracted or push away both those states? So it's essential to have a seated practice to be able to do this work.